Madam Speaker, government-run health care leads to doctor shortages, rationing of services, and long waiting lines. The United States government has been trying to run health care for the American Indians for over 200 years, and it's a miserable failure. It has resulted in medical malpractice against Native American Indians. Over the last 2 centuries, members of Congress have spoken out about the way Indians are treated by the federal government. Among those outspoken critics include David Crockett and Sam Houston. And a prime example of mistreatment today is the government-run health care for Native Americans. In 1787, the federal government agreed to provide for the health, safety, and well-being of Indian tribes on reservations in exchange for over 450 million acres. The United States government has been running Indian health care ever since. The Indian Health Service is a part of the Department of Health and Human Services. They took over the Indian health care in 1954 from the Bureau of Indian Affairs. Now Indian Health Services oversee medical care for about 2 million American Indians and Alaskan Eskimos in 35 states. Last week I talked about just a few of the tense, tragic stories of some of the victims of this U.S. government-run health care system, like Tashawn Rain Littlelight, the little girl who went to an Indian Health Service clinic in Montana. The doctor said Tashawn was just depressed, but she kept complaining to her mom that her stomach hurt and stopped eating and drinking. After going back to the same clinic, her lung collapsed. She was then airlifted to a private children's hospital where she was diagnosed with terminal stomach cancer. She died a few days later. Tashawn Rain Littlelight was 5 years of age. Rhonda Sandlin, who lives on the Standing Rock Reservation in North Dakota. She had to threaten to kill herself to finally get treatment for severe frostbite on her fingers. The government health care providers wanted to cut off all of her fingers. A private doctor happened to stop by on the reservation and prevented the amputation. Instead, he prescribed some medicine that took care of the problem. And then there's Victor Brave Thunder, who had congestive heart failure. The clinic at Standing Rock gave him Tylenol and cough syrup and sent him home. He died of a heart attack a few weeks later. Then there's Harriet Archibald, who died when her hypertension medicine ran out. She tried 5 times to get an appointment to get her medicine refilled. She never got to see a doctor before she died. And these are not isolated instances. The Cheyenne River Sioux tribal officials have held hearings on their South Dakota reservation to document conditions at the Eagle Butte Indian Health Service Hospital. Betty Crow worked on the reservation hospital for years. Betty said all they would do most of the time was hand out painkillers. Others testified at that hearing that people who had appendix problems were given pain medicine and sent home until that appendix burst. Betty's own son had leukemia. He used to get his leukemia medicine through his wife's private insurance, but then they got a divorce and he lost that insurance. He couldn't pay for it by himself, and Betty said that the bureaucrats at the Butte Indian Health Service Hospital wouldn't allow him to get the leukemia medicine from the federal government. Jermaine Means says that non-medical staff was deciding who and who would not get medical treatment. Now imagine that, Madam Speaker. In the Indian Health Service Agency, a bureaucrat, not a doctor, decides who can get medical care and who doesn't. That's called rationing. On the reservations, it said don't get sick after June because the government runs out of money and runs out of medicine. The Indian Health Service Agency itself calls their organization a rationed health care system. When the taxpayer money runs out, they can't pay for those services, so they ration. America has proven universal nationalized health care results in a rationed system of care by the way we treat the American Indians. And every nation that's tried socialized medicine has proven its results in rationing and in poor health care. There are more problems with this universal plan. To cut costs, the government solution is to pay all the private doctors the Medicare rate for their services. It's in their 1,000-page bill. They call it cutting medical costs. The main problem with that scenario is the Medicare rates don't pay for a doctor's overhead, so they run the doctors out of business. Why would anyone want to go to medical school and spend all that money just to open up a practice that doesn't pay for itself? And make matters worse, the American Medical Association has warned us that we're losing more doctors than we're getting. Madam Speaker, we don't have to wonder about health care run by the federal government, what it looks like. We have our own long, lamentable, sad, sick history to prove it doesn't work. Socialized medicine has the competence of FEMA, the efficiency of the post office, and the compassion of the IRS. It's resulted in medical malpractice against the American Indians. Just ask them, and that's just the way it is.
Ms.